Welcome to the first of our new series of webinars, Diapat Lab Talks. It is my pleasure today to introduce Dr. Moris Cadei, who will tell us about the considerable improvements provided by technology to histopathology. Dr. Cadei is an experienced, open-minded, and innovative lab scientist. We know that histopathology is at the same time a science and an art. During his long professional life, Dr. Cadei has been witnessing a real evolution, I would say a revolution in histopathology, which still keeps now being based on morphology, but has increasingly become more and more accessible, quantitative, reproducible, and predictive science. He is passionate about education and technology and is one of the founders of the Italian Association of Biomedical Scientists, ITIC. We will hear about the activities that are mostly educational at first, and now also they support guidelines to the labs. This association during his talk is mentioned several times. Before we start listening to him, I would like to ask all of you to contribute any questions that might pop up into your minds as soon as it appears during the presentation using the specific place. Every question is very welcome and precious to us. Dr. Cadei is more than happy to be given the possibility and the opportunity to clarify concepts or to expand on what he will be presenting shortly. You can write your question either in English or in Italian, or questions and answers will be presented in both languages, English and Italian. So because this point is very important, I'm now repeating in Italian these last sentences. Prima di iniziare ad ascoltare questa presentazione vorrei pregare chi è in ascolto di scrivere nella chat qualsiasi domanda gli possa venire in mente mentre ascolta il webinar subito. Si può scrivere in italiano o in inglese, le domande e le risposte saranno presentate in entrambe le lingue e daranno l'opportunità al dottor Cadei, che sarà molto contento di poter avere l'occasione di chiarire dei concetti o di approfondire certe cose che ovviamente menzionerà molto brevemente nella sua presentazione. E adesso lascio la parola al dottor Cadei. Now it is time for me to give the floor to Dr. Cadei.
I've never taught my students anything. I just try to put them in the best conditions to learn. Albert Einstein. Ladies and gentlemen, welcome to the third webinar series, Diapat Lab Talks, first semester 2022. Diapat Lab Talks offers educational webinars dedicated to lab scientists, anatomic pathology professionals, anatomopathologists, and students. Diapat is an Italian-based company successfully providing high-quality solutions to pathologists, lab scientists, and lab professionals all around the world. Today, Diapat is a fast-growing company with a worldwide presence, counting on a network of dealerships in more than 90 countries, providing both commercial and service solutions. We offer a complete portfolio of solutions for the Anatomic Pathology Lab, including 868 products. We are eager to get in touch with you. Register to our live virtual demo. Search and choose any Diapat instrument from your lab and book a live demo with our specialists. Not only products and solutions, we are there to empower pathologists and lab professionals, sharing the best ideas. Join diapatlabtalks.com, the connecting hub with a complete range of scientific articles, webinars, training resources, a state-of-the-art blog, and podcasts, hosting interviews with opinion leaders and experts. Diapat is approved CE-use provider by NSH, National Society for Histotechnology. Please follow the instructions under the website www.diapatlabtalks.com. Diapat Lab Talks include 4 webinars, starting from the first one up to June 2022. Register now under www.diapatlabtalks.com under webinars. Before starting the webinar, just some practical information. The webinar is about 30 minutes. Then we're going to have a question and answer session at the very end of the webinar. So you are kindly invited to have your questions at the very end, typing the questions in the chat for the final open discussion. Thank you.
Good morning, everyone. Thanks to Diapath and Dr. Savio for this invitation. Only 2 words about me to introduce myself. I am a biomedical scientist at Brescia University, and I've been working since 1991 in anatomic pathology. I started there years before as a student, and from the beginning I acquired all the basics of the histopathology lab, to later deal more specifically with morphometry applied to histochemistry and immunohistochemistry, and with quantitative microscopy, specifically with static cytometry or image analysis and flow cytometry. In 2002, along with other colleagues, I was a founding member of the Italian Association of Histology Scientists and Cytologists, and since 2017 I have been coordinating the group ITIC Academy. From the end of 2017, I was required by our head of department, Professor Facchetti, to deal with electronic microscopy and to acquire the basics of electronics for diagnostic and research purposes, being our laboratory both a hospital service for the Civil Hospital and a research laboratory for the University of Brescia. In 2020, I conceived and realized the project Those Who Look Inside It, and I will give you a very short description of it at the end of my presentation. I start from this image that represents the actual situation, as today, in surgical pathology, we are in the age of precision medicine. This is an educational event organized by SIAPEC, the Italian Society of Anatomic Pathology, titled Diagnostic Innovation in Precision Oncology. This event had the patronage of IUM, the Italian Association of Medical Oncology, with which SIAPEC strictly cooperates, and of ITIC for the technical methodological part. Nowadays, as you can see, the panel of diagnostic and predictive tests in the era of molecular biology has been noticeably implemented, and these are all the markers that are available today in our laboratories for molecular biology activity and diagnostics. If we want to specifically address the predictive tests, we start with HER2, also better defined as SERB-B2. The first test of the target therapy era, which is used for breast and gastric cancer. Several other markers have been subsequently introduced: ALK, ROS1, RET, and CMET for non-small cell lung carcinoma, NSCLC. Thereafter, BCL2, C-MYC, BCL6 for diffuse large B-cell lymphoma, DLBCL, and more recently NTRK1, 2, and 3 for those tumors defined as agnostic, or for fibrosarcoma and other types of tumor that can respond to drugs not specific for a particular disease. Stealing the words of Professor Facchetti, we can say that we have entered now into the theragnostic era, meaning the combination of diagnosis and therapy, thanks to the combination of the techniques of molecular morphology, a more noble term to define immunohistochemistry, with the techniques of molecular biology. Professor Facchetti made an interesting report on this topic at the meeting Cytohistology in Franciacorta, organized by ITIC in 2017. It has become increasingly frequent, the presence of a molecular biology laboratory inside histopathology laboratories, at least in larger centers, as you can see in this image. This is part of the molecular pathology laboratory of the histopathology department of Spedali Civili Hospital in Brescia, and responsible is Professor William Vermi. However, we always need to remember that even if we are in the molecular biology era, the basis on which anatomic pathology is founded is more and more represented by macroscopic and microscopic observation. In other words, by the routine work of the laboratory scientist who provides the pathologist with the slide on which he then bases his diagnosis. We know that anatomic pathology is nowadays much more complex, because although morphological assessment remains central, most laboratories can provide histochemistry, immunohistochemistry, and immunofluorescence techniques. Less frequently available in laboratories are techniques of electronic microscopy, flow cytometry, cytogenetics, FISH, or molecular biology, even though we know that nowadays those parameters, above all those provided by molecular biology, are requested by the oncologists for the choice of treatments. It is not me stating that the microscopic observation remains at the center of diagnostics, but it is this gentleman, Professor Joan Rossai, one of the greatest pathologists of the world, who unfortunately passed away in 2020. In his paper published in 2007 in the magazine Investigation Laboratory, he wrote that morphology was able to give such a lot of information in a simple and cheap way. And obviously, this was not declared to discredit the molecular biology era that we were then entering, but to make people understand that all the diagnostic process is based on the morphological assessment. Every diagnosis still starts from the morphology and cannot do without it. Because a good hematoxylin and eosin stained slide still remains today the starting point for a pathologist to make a precise and accurate diagnosis. It is evident that by the years, standardization techniques have been adopted because, as stated by the father of the Toyota brand, Taiichi Ohno, no improvement is possible without standardization. Standardization provides the scientific basis for evaluation and amendment by identifying, as you can see in this diagram, the evolution of improvement. Nowadays, the anatomic pathology laboratory is characterized by some steps still of manual handcrafted work, and other steps that, over time, have become automated, more inspired to an industrial model. The manual steps are accessioning, cutting, and embedding. The steps that over time have become automated are tissue processing, histochemical and immunohistochemical staining, slide mounting, and reporting. In 1989-90, when I started to attend a lab as student, I learned the basis of tissue processing in this book that was considered a kind of Bible for histopathology techniques, the Bancroft, and this made me understand that all the steps in tissue processing are fundamental for the purpose of obtaining a good quality histological specimen. At that time, automatic processors already existed in the labs, and they had evolved from first instruments in 1950 to further, more advanced models, providing increasing standardization levels to guarantee the quality of the specimen. Up to today's last-generation tissue processors, like this one of Diapat that is provided with a fully evolved management software. The same happened with automated stainers. This is the first dissertation that I supported in the laboratory still as a student in the 90s. It was a histochemical study of lung carcinoma, and I performed manually all the histochemical stains needed for this study, including hematoxylin and eosin, that we can consider as the basic histochemical stain, and several other like alcian, PAS, trichrome, or reticulin stain. Here we have some staining examples not specifically referred to in that study. At that time everything came in a manual way, starting with the preparation of reagents, and all was very handcrafted. There has also been a big development here today. This is the Giotto stainer from Diapat, which allows staining of slides to be carried out automatically, and even allows the addition of the final mounting. This is possible using an interesting innovative system, not based on the use of traditional cover slips, but on the use of a new polymer, which has recently been presented by Diapat. Another aspect that has evolved over the years is the automation of the immunohistochemistry laboratory. I present here very briefly a degree dissertation which I contributed to in our laboratory in 1996-97, in which an economic evaluation was even made taking into account the costs of the manual method compared to those of the automatic method, and also the savings that this entailed and, in particular, the number of slides that could be processed. In conclusion, this dissertation showed how mechanization and automation are useful for a rapid, reproducible and accurate work. Even the most conscientious technician cannot do a good job if he or she has to carry out a large number of operations for a large number of samples. The quality cannot therefore be at an optimum level. One can expect decreased attention, lack of precision, increased work, imprecision, increase of work, non-compliance with procedures. In addition, there is no question that appreciable differences will be found between one operator and another. This dissertation concluded by saying the solution can be found in automation, which, in the laboratory, is the first mean, allowing results to be obtained reliably, quickly, and cost-effectively. Here is a picture of the immunohistochemistry sector of our histopathology laboratory. It is becoming increasingly common to find spaces equipped with several instruments dedicated to large immunohistochemical routine. Clearly, this type of organization is more common in large centers. But nowadays, it is more and more common to see even small laboratories equipped with automatic immunostainers. The cytometric techniques have met the same fate. As I told you at the start, I have always been involved in morphometry, in image analysis. And this is my thesis, which was entitled Methods of Cytometric Study in Histopathology. Our aim in this study was to transform qualitative data into quantitative data. Especially with regard to the type of diagnostics to which I had been dedicated, namely the determination of estrogen receptors for patients who had breast cancer, it was important using the technique of image analysis, or static cytometry, to provide the oncologist with a report including not only qualitative data, but also quantitative data. That is, to quantify the estrogen receptor positive tumor cells, or the positivity of progesterone receptors, or the level of cell proliferation, which was obtained with Ki-67. Therefore, all our effort was devoted in those years to trying to transform qualitative data, linked to observation under the microscope, into quantitative parameters through the use of dedicated software. Software that, in our laboratory, were of a handicraft nature, even if at that time we already had obtained help by an IT expert. A dedicated software allowing provision of numerical data through the application of thresholds to the acquired images. In time we went even further, because the idea was to imagine that what we were seeing under the microscope could be brought to the cytofluorometer, thinking that an instrument with a flow system could give information quantitatively reproducible and quicker in terms of application than static analysis, which was recognized by everyone to be a rather laborious, time-consuming investigation. In 2000, though, something else happened. I remember it very well, like it was yesterday. Our reference oncologist came to the laboratory and told us that some publications had come out saying that it was necessary to become able to test HER2, also known as SERB-B2. This can be considered the first target of a therapeutic response. It was important to be able to deliver targeted therapy using drugs specifically targeted at cases showing this type of positivity. At that time, the Hercept test was introduced, which declined some aspects of sample processing. Thereafter, as you can see in this picture on the left, recommendations came out about the minimum requirement standards for reporting HER2 status in breast cancer. These are the joint guidelines of CIAPEC and IOM, because here the problem with regards to estrogen and progesterone was of giving a figure that was not only positivity, but that would define the intensity of positivity, ranging from 0 for a negative sample up to 3+ for highly positive tumors. Clearly, this evaluation opened up a whole series of aspects linked to the fixation time, as I have highlighted in the red box in the central image, and obviously to the consequent evaluation, which was carried out by the pathologist at the microscope. Let's say that with these tests we were in some way entering into what was defined by Roberto Giardini, a pathologist who gave a report at the 2012 ITIC National Interregional Congress, a global approach test, meaning that somehow, in addition to the morphology within the pathology report, there was a piece of data that resulted from a close evaluation of the pre-analytical phase, of the subsequent analytical phase, up to the reporting and interpretation of the data that was delivered to the histopathologist. In some ways, therefore, the process of corporatization had led to what has become a must, track to trace. Because while it is true on one hand that we are not like a factory similar to that represented in this picture, on the other hand it is true that we do in fact have an input, the biological sample, which enters our laboratories, and an output, which is the consequence of processing this sample, represented by the report. And therefore, even if we are not a factory, it is clear that the procedure must allow us to keep everything under control. This was later reinforced in these guidelines of the Italian National Institute of Health, which deal with the traceability, collection, transport, preservation, and storage of cells and tissues for pathological anatomy diagnostic investigations. Thanks to Professor Anna Sapino, to other pathologists and the CIAPEC, these guidelines have been published and distributed to all histopathology laboratories in Italy. And today, any pathology laboratory should follow these guidelines. The whole thing stemmed from a number of publications, such as this one in 2016. In this original work, it was highlighted how the quality of the result depends, with regard to pathological anatomy, particularly on the pre-analytical phase and processing, by identifying, as you can see in the image on the right, a whole series of steps that are clearly conditioned and consequent to the processing of samples by the laboratory scientist, clearly showing that each step can have a consequence on the final result. And indeed, in this work published by a group also including Liuk in Milan and Varese, the errors in histology were analysed and a flowchart of the histopathological processes was produced, where the causes of error could somehow fit in, and a graduation was also assigned, as you can see in the picture, ranging from score 1 all the way up to score 10. And obviously an error with score 1 had no effect on the preparation, whereas a higher index was given to an error that somehow affected the final diagnosis. However, the curious thing about this work was that it showed that 73% of the errors are only detected at the end of the process. It is clear that afterwards it becomes complicated to go back and retrieve a sample that in some way was not properly processed. In 2017, we decided to move forward with our association, imagining that we could administer to the histopathology laboratories a survey on traceability, as there was an active collaboration with the Italian Group of Digestive Pathology, GIPAD, of CIAPEC, coordinated by Dr. Saragoni and Professor Maria Guido. We decided to accept a proposal from Dr. Vincenzo Villanacci, a gastrointestinal pathologist of the Spedali Civili, whose aim was to make people understand how the orientation of biopsies, in this case endoscopic biopsies of the gastrointestinal tract, could provide a methodological approach that would make it a good practice. As I have highlighted here, the course aimed to present the different steps of this collaborative process with a view to improving the daily practice, from the endoscopy room to the histopathological report, in the ultimate interest of an accurate and appropriate diagnosis for therapeutic purposes for the patient. In some ways, the importance of the joint work of a multidisciplinary team was stressed in providing the patient with the most adequate possible report. This work led to a subsequent collaboration with the Amici Onlus, Association of Chronic Inflammatory Intestinal Diseases, and with the IGIBD Scientific Society, International Scientific Society dealing with IBD. This is a brochure highlighting the histological aspects in Crohn's disease and ulcerative colitis, which was then distributed to all patients by the Amici Association. And as far as we are concerned, as ITIC Association, we decided to publish this position statement together with CIAPEC, GIPAD Group, and IGIBD. This was the first time that ITIC had taken part in a technical methodological recommendation paper. Digital transition. This is certainly a very innovative aspect in pathological anatomy. even though the transition from analogical to digital in the laboratories dates back to at least 15 to 20 years ago. This is a dissertation prepared in our laboratory in which this transition from the classical use of reflex cameras, with all the subsequent development of pictures taken in specialized photography centers, for those who did not have a darkroom in the lab and could not process and print images in the lab. Clearly, we know that the transition to digital imaging capture was a major innovation, with all the possibilities of computer management. Let's say that today the real novelty is the fact that we have moved on to what is defined as digital pathology, which means going beyond the camera or the digital camera mounted on the microscope, even though there are still instruments and microscopes equipped with these systems. But let us say that nowadays we have moved on to digital scanners. By now, all companies are in some way setting themselves the objective of having a scanner equipment on offer for the market and for pathology laboratories. Here are just a few representative ones. So, what is pathological anatomy interested in? It is how the process and therefore the organization of work is changing in relation to this technological innovation. Because more and more in the future we will probably no longer prepare a collection of slides on trays, as classically we are used to doing now, but we will upload the cytological or histological slides either with immunohistochemical staining or with histochemical staining on the racks for the scanners. So what does that mean? It means that somehow every laboratory in the future will need to fulfill requirements, which are the necessary condition for these digital scans to produce images with the highest quality. And so here, once again, the scientist's experience in preparing the slides will play a fundamental role to guarantee the quality of the image, and therefore we, as an association, imagine that there will be the need for highly competent technicians to follow all the phases of the process, because the quality of our preparations will be required to be more and more excellent. Above all, as Diapat also proposes with its innovative system, there must be a suitable mounting of the slides for high-quality images to be acquired and, above all, systems tracking the entire process. And so, especially for the pathologist, there will be a new point of view. Probably more and more, in the future, the pathologist will examine cases on a monitor rather than evaluating them with a microscope. But surely there will be a new point of view for the laboratory scientist too, who will need to organize these scans. For these last slides, I would like to thank my colleague Gianna Veronesi, the manager of the histopathology laboratory of the Poliambulanza Hospital in Brescia, who kindly gave them to me. They had been presented at the ITIC National Congress in Padua in 2021. What changes today with these scans? That we are entering an entirely new chapter in histopathology, namely the artificial intelligence. By now, it is increasingly common to find papers like this one of 2021 on ulcerative colitis, where use is made of deep learning, a technical term for artificial intelligence. This is a publication that deals with a whole series of identifiable aspects at the histological level. In our laboratory too, taking advantage from the experience with the orientation of biopsies, as I was saying earlier, we imagined that we could find a system to automatically evaluate with high performance, like in the image above, distances or width of glands, rather than, as in the bottom left image in the green box, certain tissue characteristics such as cryptic abscesses, rather than, as in the right-hand image in those red and black little circles, a true characterization of cellularity. Therefore, starting from this experience with Dr. Villanacci about the importance of the topographical distribution and the orientation of samples, we decided to carry out an experiment, obviously relying on experts. And so we retrieved and topographically mapped some of our routine cases of ulcerative rectocolitis and Crohn's disease, as you can see in these images, where it is possible to identify the districts clearly and unequivocally with the microscopic vision. And we imagined a tool, an algorithm, able to do an automatic tissue segmentation into various topographical levels, steps that go from tissue segmentation to even a colored identification of the different districts. And then, consequently, the possibility for an algorithm to identify the sectors of these segmentations. I cannot give you any further details on this topic because it is a work in progress at the moment. We are talking about the harmonization of technical methodological diagnostic criteria in the evaluation of histological specimens with suspicion of ulcerative colitis and of Crohn's disease. As I was saying, to be able to carry out this experience, we had to rely on artificial intelligence experts. Here we had the support of an expert, the IT engineer Cesare Furlanello. But the work we are doing is together with the endoscopists, with our gastroenterology team coordinated by Professor Chiara Ricci and the group of pathological anatomy of Perugia, with the availability of Dr. Dal Sordo. This group is supported in its work by the company Orobix in Bergamo, which deals with artificial intelligence and already has experience with the application of artificial intelligence to health management and within the histopathology laboratory. All of this is to say that, as highlighted in this review published in Nature Medicine, more and more in the future we will talk about deep learning in histopathology, from diagnosis to the clinic. And here, as highlighted in the image on the right, you can see how in one section, in this case of a kidney, at the top you can see the histological image under the microscope. In the central image, you can see the districts of this section highlighted by the pathologist, and below, the last image with an incredible overlap of tissue segmentation performed by the software and the algorithm. This demonstrates that it is possible to identify districts through algorithms that have been trained to do so. There are also publications not so strictly scientific addressing this topic, such as this one in Focus, a popular magazine dealing with science. This article in 2018 highlighted the fact that artificial intelligence would somehow change lives, making explicit reference to the study that IT engineers were doing in multidisciplinary teams, especially on robotics. But it stemmed from the fact that, as you can see in the image on the right, the title Checkmate to Man, having computer intelligence made giant strides. A computer system had beat in a chess match the world's most experienced chess champion, as if to demonstrate that artificial intelligence could compete with human intelligence. And the following year I came across this book by the French surgeon Laurent Alexandre, entitled The Intelligence War, in which he pointed out that in the next 30 years many kind of jobs would even disappear because they will be done by robots with artificial intelligence. Perhaps this is a provocation to promote his book too, but there is no doubt that the subtitle Artificial Intelligence versus Human Intelligence, rather than intelligence in support of human intelligence, almost showed a competition between the two. So, heading towards the conclusion, if we were to imagine what the future holds, I think we can say that there will definitely be a shift from automation to innovation, with the central figures of the laboratory scientist in terms of preparation of slides, the pathologist of microscopic diagnostics, and all the other biologists and biotechnologists for specific methods and tests of molecular biology. This is an image that I wanted to put up to demonstrate how in some large environments, this is the molecular diagnostics laboratory of a blood transfusion center, these instruments allow, especially for the production of blood tests, that hundreds of samples are processed every day. Thousands of annual tests are carried out by these instruments that guarantee the quality of the data and, of course, the patient's safety. So I believe that in the future, histopathology will also see, to go back to the original title of my presentation, the standout of instrumentation. but I see these instruments as being governed by expert scientists who are certainly becoming more and more knowledgeable in the IT field. And so I believe that this transition, which we could define as technological, will necessarily mark the transition from the craft model to the instrumental model, which undoubtedly needs to be governed to not be overwhelming. And here I have used Confucius's words to conclude by saying that this presupposes a change. It is a question of whether we are ready for this change. But as Confucius said, change is necessary if we want to aim more and more for happiness, gratification, and satisfaction. And in this case, I referred this concept to the working environment. With respect to this, in concluding, I thank you for your attention, and I would just like to let you know that on behalf of ITIC, I am the promoter of a contest, Those Who Look Inside Us, because that is how we were defined by Dr. Santina Bianchini. She is not a part of the medical and health environment because Dr. Bianchini is a professor of photography at the LABA, the Free Academy of Fine Arts in Brescia. But when she came to the laboratory to see what we were doing, she started by saying, "Ah, you are the ones who look inside us." And from that came this idea, and we launched a contest, which you can go and get information about on our social media. Cells as Works of Art, in which I invite all those who have histological images, who have preparations somehow reminiscent of a form of art, to send them to us, because this contest has allowed us to create panels that will be set up and displayed in hospitals and laboratories in order to turn it into a traveling photography exhibit. And we thought this could be a way to try to make people outside our laboratories aware of what pathological anatomy is. Patients and those waiting for a histology report will know what the processing of a specimen in pathological anatomy means and how this is done. Thanks again to Diapat for this opportunity, and I remain at your disposal, of course, for any questions you might have.
Okay, many thanks, Dr. Cadei, for your interesting presentation. Now it is time for the Q&A session. I don't see any question from the audience so far, therefore to break the ice, I will start with a few questions myself. First question, as you pointed out in your presentation, despite the technological advances in preparation of specimens, histopathology diagnosis still is based on the simple microscopical evaluation of the H&E stained tissue section. Will this remain the case in the future? I translate the question in Italian. Dottor Cadei, come lei ha evidenziato nella presentazione, nonostante tutti i progressi che ci sono stati finora nell'allestimento del campione istologico, alla fine l'anatomia patologica si fonda ancora la base per la sua diagnostica sulla valutazione di un semplice vetrino colorato con ematossilina e usina. Sarà così anche in futuro?
Sì, innanzitutto grazie per questa opportunità. Io credo che l'ematossilina usina, che esiste da più di 150 anni nei nostri laboratori, lo sarà e continuerà a esserlo anche in futuro. È fuor di dubbio che l'innovazione tecnologica, come ho cercato di evidenziare, sempre più aiuterà il tecnico di laboratorio a standardizzare il processo metodologico, e questo ne andrà anche a beneficio ovviamente del patologo che deve visionare il preparato e del paziente.
Okay, so answer of the answer in English is Dr. Cadei said that the H&E staining has now endured more than 150 years, and he believes that it will endure in the future. For sure, the technological innovation will increasingly help the biomedical scientists to standardize the methodological process, and this will be for sure to the advantage of the histopathologist and of the patients. Second question is about traceability. So traceability has become essential in any laboratory to guarantee the quality of the entire process of sample preparation. What is the role of the biomedical scientists and of your ITIC association in this methodological context? In Italian, una domanda che riguarda la tracciabilità. La tracciabilità è diventata fondamentale in ogni laboratorio per garantire tutto la qualità del processo di allestimento dei campioni. Qual è, secondo lei, dottor Cadei, il ruolo del tecnico di laboratorio e anche della vostra associazione ITIC nell'ambito di questo contesto metodologico?
Sì, è fondamentale fare formazione e ITIC è nata proprio per questo, con questo obiettivo. È evidente però che negli anni, quest'anno festeggeremo il 20° anniversario di fondazione e dopo il riconoscimento che abbiamo avuto al Ministero della Salute come associazione tecnico-scientifica, dovremmo concentrarci su tutte le tappe del percorso tecnico metodologico e quindi i tecnici di laboratorio e la nostra associazione dovranno sviluppare una sorta di certificazione di processo oltre che una certificazione delle competenze acquisite.
Okay, so Dr. Cadei, answer is that education is essential, and to provide education to the biomedical scientists was the first purpose of this ITIC association. By the time other duties have added, because after the recognition of this association by the Ministry of Health, recognition as technical scientific association, now ITIC needs to focus on all the stages of the technical methodological process in order to produce and to share guidelines and advice. The biomedical scientists will be required to develop not only a process of certification, but also a certification of skills. A third question about artificial intelligence. The artificial intelligence and the so-called deep learning have made their way into the histopathology thanks to the digital slide. Will this approach be useful not only for diagnosis or for setting up samples as well?
Sì, sicuramente l'intelligenza artificiale avrà uno sviluppo notevole in futuro. Se ci proiettiamo nei prossimi 20-30 anni, molti strumenti in uso nel nostro laboratorio saranno dotati di sistemi e di software di intelligenza artificiale e sicuramente in futuro anche i robot potranno svolgere alcune funzioni tecniche. È evidente che è un processo, come ho detto nella mia presentazione, che si deve governare per evitare di essere governati. Per me, ma credo anche per la nostra associazione, vale la regola che deve essere lo strumento al servizio dell'uomo e non viceversa.
Okay. So artificial intelligence will undergo undoubtedly considerable development in the future. If we project ourselves into the next 20 to 30 years, many instruments in use nowadays in laboratories will be provided with softwares with artificial intelligence. And even in the future, robots will be able to perform certain technical functions. It is a process that needs to be mastered to avoid being mastered. In Dr. Cadei's opinion, it has to be the instrument that serves man and not the other way around. I can't see any other questions from the audience. If there are no further questions, I would like to conclude by thanking you for staying with us until the very end of this webinar. And I thank Dr. Cadei for his interesting presentation. And I invite the audience to register for the next webinars to be held once a month. The next 3 webinars will focus on technical and diagnostic issues in specific fields. Next one is on April the 12th, and it will be on the use of immunohistochemistry to differential diagnose small blue cell tumors of children. And the speaker will be Dr. Armen Mikitarian from Yerevan, Armenia. In Italian now, se non ci sono altre domande, concludo ringraziando tutti per essere rimasti con noi fino alla fine di questo webinar e vi invito anche ad iscrivervi per i prossimi webinar che avranno cadenza mensile. Ce ne sono 3, i prossimi saranno tutti centrati su specifiche problematiche tecnico-diagnostiche. Il prossimo sarà il 12 aprile e parlerà dell'utilizzo dell'immunistochimica nella diagnosi differenziale dei tumori a piccole cellule blu dell'infanzia, con un relatore, il dottor Armen Mikitarian, che ci farà questo webinar da Yerevan, Armenia. Adesso vi invito a fermarvi ancora qualche minuto, ci sarà un breve video che DIAPAT ha preparato per noi in questa giornata internazionale della donna sul ruolo delle donne nella scienza. And now we conclude with a short video that DIAPAT has prepared for us for today's is International Women's Day, and the video is about the role of women in science.
Grazie, thank you very much.
But